Hello everyone, welcome to the second seminar of the COVID-19 Working Group of RDA. Let's just wait a few minutes to see if more people are attending. The numbers are going up quickly at the moment. Okay, so we can begin. The structure of this webinar is as follows. We'll begin with a brief overview of the status of the working group as a whole, recapping largely what we said last week and giving an update of that. So some of you may have seen this part before. The main part now will be the subgroup updates, and we will hand over to the moderators of each of the subgroups for most of those. And then we will give you an update on the processes and the timelines for the working group as a whole. Should have said I'm Juan Picaregui, one of the co-chairs, and our other co-chairs are on the call as well. We'll cover that in a moment. If you do have questions, we'll take questions at the end. Please use the questions feature in the control panel in GoToWebinar rather than the chat for your questions, as this makes it much easier for us to manage the questions and mark them as answered as we do. If you attended last week, you'll know that there were quite a lot of questions that we didn't manage to answer. We've answered some of those offline, and that we're collecting and reporting on those as we go as well. So I'll give a very brief overview of the working group themes and structure, and then hand over to the subgroup moderators. So the working group aims are really to define detailed practical guidelines on data sharing, specifically around COVID-19, in order to help follow up, in order to help best practice to maximize the efficiency of the researchers and others involved in the work around COVID-19, mostly aiming at researchers there. Also to develop guidelines for policymakers, but I see this as a secondary objective because others are doing similar work. OECD, for example, are also developing policy brief, and we're working with them to align that side of our work. In very short time scale. The first is a best practice guidelines for each of the 5 subgroups and overall where common things are coming out. A set of recommendations for researchers and policymakers to help maximize data sharing. To support that, a catalogue of key resources that will inform those guidelines, data sets, standards, tools, repositories, etc. And possibly, although this may take a little bit longer than our initial deadline, a decision tree to help the navigation of those resources and the recommendations. The overall work is structured into 5 subgroups, one on omics, one on clinical, one on epidemiology, one on social sciences aspects, and one on community participation aspects. Clearly, there'll be some overlaps between these, possibly some gaps as well, and we'll be working across the groups to try and identify those overlaps and potentially gaps. For example, in the area of ethics, there'll be a cross-subgroup team working. So with that very brief introduction, I think it's more important, I hope, that people on the call have understood the aims and outputs of the working group already. So I think it's best to move straight on to the 5 subgroups and hear about each of those in turn. So the first subgroup is the omics. The co-chairs liaising with it in order to do the administration and the coordination across subgroups. And a group of moderators, in this case, Rob Hooft and Natalie Myers. And I believe Rob Hooft is on the call and will give us a brief introduction to this subgroup. Now, how do we get Rob to be able to speak? Can somebody help?
I don't know if Rob can unmute himself. I'll just look through the attendees.
I've just unmuted him.
Okay, great, thanks.
Great.
Yes,
Rob, are you there?
Yes, that works.
Okay,
that works.
so
Yeah.
I'll advance the slides as you wish, so go ahead.
Yeah, so this is the generic slide that gives the direct links to the pages on the RD Alliance website for our activity. For the moment, Natalie and me, we just have been discussing a little bit on how we should get started. And as you can see on the next slide, actually, we have the assignment as the other groups to do 3 things. We first have to make a set of guidance documents, as discussed by Juan already. Another important thing is to make a research list that is relevant to our subtopic omics. And then also the idea is to make a decision tree that helps the researchers navigate to the specific omics resources and guidelines that we have created. Looking at the timeline, it will be very hard to realize all 3 of them at the same time and for the first deadline. So the highlight on the second one gives our priority. We think that the first thing to do is to really list all the resources. And for this, we will call upon all the experts in the omics to let us know where the suitable resources, tools, as well as data are available, and also how to prioritize creating the guidelines for those. To be able to do this, we have set a time slot on Thursday, coming Thursday. The Zoom details are on the wiki of the group, and please let us know if you want to participate in this first meetings, because to avoid Zoom bombing people, we will need to let individual people into the meeting by ourselves. Feel free to contact either me or Natalie. We are available via email or via Twitter. And if you want to contact the whole group, the email list is here as well. Thank you, Juan.
Okay, thank you, Rob. As I said, we'll save the questions at the end so that we make sure that we get through all the talking. It won't take us very long to do the talking. We should leave plenty of time for questions. So the next group, I'm not sure who's speaking to that. Anne, are you speaking?
Yes,
or
that's me.
Tell us who is?
Yes, that's me. Can you hear me?
Yes.
Okay. Yes, okay. So I talk on behalf of the 3 moderators who are on this slide, and they may intervene in the answer to question if they want to add or if they want to add something. This group, for the moment, subgroup, has had a number of conversations between the moderators. The assignment is the same as for the other subgroups. The discussions going on are on the scope, what is included in this clinical subgroup, what is more to the omics of the epidemiology. So the interaction between these subgroups will be important. The scope obviously has a priority on clinical presentation, a clinical landscape, and on the clinical trials. And Sergio is specifically moderating the part on clinical trials. On a Google Doc document indicated on this in the Google folder, there are a number of elements, and the first one, considering the resources, are the a list of resources regarding clinical trials. The moderators have also set up a call for the whole subgroup that will be tomorrow, the 15th, at 12:30 UTC, Universal Time. And at that meeting, there will be a number of decisions taken on the frequency and the timing of the next calls. And we have in this conversation said that the resources are important as resources to inform the guidelines. And there is no ambition to be exhaustive in the resources that will be listed. I think that's all what I can say on behalf of the moderators for the moment.
Okay, thank you very much, Anne. The next subgroup, the do you want to begin this?
Not sure if Juan may have dropped off. But... Oh, there we go.
Okay. So I may have a connection problem. The next group is epidemiology. Priyanka is the co-chair for this. Priyanka, do you want to begin?
Claire is online with us, who's a co-moderator for this group. So I'm going to let Claire present.
Okay, she's unmuted.
Okay, you can hear me now?
Yeah.
Yes.
Okay. So I apologize, my computer decided to do a long series of updates, and so I'm logged in on my iPhone, and I can't see the slides that we prepared. So going from memory, we had our first meeting yesterday. We're planning on having 3 meetings per week, Monday, Wednesday, Friday at 12:30 UTC. There were 16 people came to the meeting yesterday. We have prepared a series of guidance documents, preparatory document, organization documents in the Google Drive. We also did a SurveyMonkey membership survey to get a sense of who was in the group and their time availabilities. So again, going from memory, there were out of these 60 people who signed up for the work group, there were 18 people filled in the survey. The time availability in between meetings ranges from 1 or 2 hours per week to 15 hours per week. Most people, if I recall correctly, is approximately between 1 and 5 hours per week. We have a well-represented group in from the different fields, epidemiology, a couple of people from public health. I would say perhaps more strongly represented on the numeric side of computer science. What else? I think those are the most important things that we wanted to ascertain. Priyanka, is there anything that you can recall? I can't see my slides, so.
I think you've covered most of the elements, Claire.
Right. So we
are
started.
looking
Anne,
forward
can
for
I
more
add?
on. Yeah, sure.
I think you have a number of people with the ethical and legal competence also.
Right, right. And so we had spent the meeting yesterday talking mostly about, we did a scoping exercise and some brainstorming. And so now we need to prioritize that list, and we have a sheet for tasking and work breakdown. So I would say there was good participation. I'm very pleased.
Okay, thank you very much, Claire and Priyanka. The next subgroup is the one. Oh. Ingrid, would you begin that?
Well, I think that both Amy as well as Irina are on the call, so I would like to give the moderators the opportunity to present, if they're willing to do that.
Yeah, hi Ingrid, can you hear me?
Yeah, we can.
Oh, good. I can go ahead unless Irina jumps in. I'm Amy Pienta, and as mentioned, Ingrid is our connector to the RDA working group for COVID. Irina Kuchma and myself are the co-moderators, and like the other slides, these are the links to our subsection on the RDA website. And if you go on to the next slide, I'll show you a little bit more about what we have been up to. The subgroup for the social sciences has around 60 members. We held a kickoff meeting on last Thursday at 11 UTC. We had about 11 participants, which we were pleased with, given that we sort of rushed to have our first meeting, trying to leave ourselves as much time for writing as possible. In that meeting, we gave a presentation of what had been presented earlier in the week with some additional slides. Mainly, we discussed the scope of the group and tried to gather a bit about the expertise of those that were attending the call. And we also started recruiting writing volunteers. Because that Thursday meeting worked pretty well, we will meet weekly the next 2 Thursdays, so this Thursday and the following Thursday as a group to come back together as a full group. And if you move to the next slide, I think I'll show you the range of expertise that we had on the call. We seem to represent, and I know there's a lot of, we've been very thoughtful in considering how we are distinct from the epidemiology subgroup. And it seemed like we had representation from sociology, psychology, political science, as well as economics and demography amongst our group, as well as information scientists who help those disciplines share data. It's okay.
Sorry, I've got confused as to which slide I'm supposed to be showing. Is this the right one?
Scope. Yeah, scope.
Yeah, sorry.
Sorry. And then we talked a lot about the various ways that social scientists were engaging with data to measure the impact of COVID-19. And so we had interest and expertise across this really large group of topics for the most part, but some of them will drop off. We expect that our scope will reflect the expertise of the group that's writing the best practice guidelines. And if you move to my last slide, I'll tell you about what we're doing going forward. The next, yeah, perfect. We did start writing yesterday. We met with a smaller group interested in data collections as well as metadata standards and data quality, and discussed various aspects of the recommendations that we wanted to make. it was successful. We produced some text, which we were excited. And to that end, we've sort of divided the work into having writing sprints around 3 sets of the recommendation areas at a time. And so we have 2 more upcoming sort of co-writing sessions this week. So one is tomorrow, where we will begin writing legal and ethical, the data sharing and long-term preservation, and the data management responsibilities sections. And so we kind of envision it as a working session, a co-working session, and then people making additions until the group reconvenes around that writing topic. So that will be Wednesday, and then the other areas will meet again for their second time on Friday. But again, we are grateful to our members, and thanks to Ingrid and to the rest of the co-chairs for the support. It's allowed us to be very productive quickly. So thank you.
Okay, thank you very much.
Right. And then I'll confess this final group, the community participation, was the last one to get set up. And I've only informed the moderators about this last night, so I'm not sure they've seen the slides. So I'll give a quick run through, but I think Kieran and Susanna are on the call. So by all means, raise your hand and interject in this, because you know the work better than I do. But we actually, at the last webinar, we didn't have any moderators, and we now have 6. So it was really great to have so much input from the community. So I'll give you just a very brief introduction to them. So Joanne is working in the COVID area specifically, doing some work around hackathons to develop apps for collecting the patient data. So specifically this kind of area of community inputs. And Daniel Meachin, some of you may know, he's involved in a lot of citizen science projects, Wikidata, and has been working on the NIH response to Zika in the past, and now some COVID stuff. Kieran and Susanna are both more from the infrastructure side of things, working in the health domain, but on various sharing platforms and resources like Fair Sharing. And Ava and Timea have been doing a lot of work around the engagement side of things. That's through like OSPP or Young Researcher Networks and various science communication. So we've got a really nice mix across the moderator group of the domain knowledge, the infrastructure, and lots of that engagement activity. So if you move to the next slide, I'll give you a quick overview of what we've done so far. So we had a first call last Thursday. This was the one really just to talk to the moderators around the remit and how they'd work together. One of the things we did on that call, Kieran set up Slack for everybody. And we actually have this option. We can, if the other groups want to use Slack, we can have Slack for all of the groups. And the moderators since then, they started scoping out the area of work. And there's a paper that went out for consultation just before Easter. And they're also planning to host a webinar soon to discuss further. And one of the key messages that I would flag from this, which I really liked in the notice that went to the group, was that in the interest of time, we need to focus on the good rather than the best. There's always more we can do, but we want to just try and work in a rapid way to get the guidelines out. So if you move to the next slide. The initial document that has gone out for comments, there are a few key areas that addresses. So it's looking at the purpose and the scope of the group, how that's differentiated from others. What are the key areas or tasks that we should be looking at, and what are the priorities in that? Because in this first 3-week iteration, we maybe won't be able to get through everything. So there's some proposals in that paper about how the work can be prioritized and organized. That's out for comments until the end of today. And the plan, if we move to the next slide, this is like a proposal in that document about the fact that we should hopefully have a prioritized list of work from tomorrow. and then we can try and get people into small groups to pick off one of the priority areas and to start drafting around that. And like with other groups, the idea is to kind of have quick writing sprints, so to work on a topic for a few days and then to pass this through to another group to do the review, and we can work through those different priority topics in order, reallocating to new groups as needed. And then towards the end of that 3-week period, we'll have a small editorial team to try and bring everything together into a coherent piece of work. So that's the main work that's happened literally just over Easter weekend. So huge thanks to the team for the hard work. I don't know if Kieran or Susanna raised their hand and if they want to say anything in addition to that overview.
They haven't raised their hands.
Okay, then that's hopefully clear enough, but by all means raise questions in the chat. So if we move on, there's just a couple of closing slides which I'll just run through. So the first one around processes, there have been a couple of things raised both on the webinar last week and also in our call. So I mentioned that we've set up a Slack for our group. Potentially, we're willing to set up Slack channels for the other groups if they'd want to use those, but we didn't want to just allocate them if the moderators aren't happy with that. So this is something that we'd be, interested to hear your feedback on. There's also been a lot of discussion around Zotero as potentially a better way to gather resources than the Google Sheet. And after this webinar, we have a call with all the moderators and the co-chairs. And these are 2 issues that we can chat about on there, and then let you know what's the best approach. But we're very open to, alternatives like that. And then the next slide, Juan. Quick update, we had this timeline in the last webinar, and I just wanted to update you kind of where we're at in this 3-week cycle now. So the overall approach is to try and get the guidelines out quickly and iterate on those, and be doing the work across these 5 groups in parallel. So we're still at this phase of collecting resources, and starting, you've seen that various groups are starting to draft that text or to allocate out different sections to different teams. So that's the main priority for this week, and that will continue on into next week. And it will be kind of from the 21st to the 24th of April that we're really wanting to try and review and revise the guidelines and come out with a clear set of recommendations to release from the 24th. And that is like this first phase. There will be then further iterations. And I think with each group, as I said, in their scope, there may be things that aren't in the priority for this first run, but they're pieces of work they expect should come at later stages. And then I think the final slide is just about the Q&A. So you've already had the notice to put questions in the Q&A panel, and I think I saw some coming in. And there is also this hand up option if you want to speak out. So now I think we've got half an hour for questions, and I don't know if Juan or Mark, are you going to moderate that?
Yeah, I can.
Yeah, go ahead, Mark.
Yeah, I'll moderate. And actually, the first one's for you or Rob. One, it's what kinds of resources are you looking for in the omics group?
So I think Rob can answer that if he unmutes or someone unmutes him. Oops. Rob, do you want to answer that question about what kind of resources we're looking for in the omics?
Okay, so the first thing we need to know is what kind of omics data people are actually collecting for COVID-19. So it's obvious that there are lots of genomic sequences for the virus. There are also people working at the host genomics, but we also have to find out whether people are already collecting other things. Once we have that list of the omics types of data that we have to prioritize, then for each of those, we would like to know what kind of data standards should be used for these data, the kind of repositories that people should use and why, and then we're going to work on that. And of course, the tools people are actually using for analyzing the omics data and why those tools are specifically useful for COVID-19 data is very useful to know as well. So it's not just the resources, but yeah, in order to be able to, in the end, make guidelines and decision trees, we also need to figure out under which conditions people use which tools, which repositories for this data.
Thank you, Rob. Next question.
Yeah, there's another question for OMIC, so we might as well stick with that one. Somebody missed the OMIC's group typeline. Could you repeat it or post it? And I can pull that out and put it in the answer part. So I'll look after that.
They also ask if you could show the slides again while you're addressing the OMICs.
So that was the timeline was the question?
Yes.
So the only thing we have at the moment is the very next step, which is the first meeting of the subgroup on this Thursday, and we will discuss the rest of the timeline with the group on that day. So it's timeline, it is prioritization, and it's who will do what by when will be discussed at this first meeting.
Okay. Next question's for the EPI group. So you may want to go ahead to the EPI slide, Juan. And the question is, how can we participate in the survey if we do not have a chance to fill it in yet? So I guess question about the survey. Looks like the membership survey. And that would be for Claire or Priyanka, I guess.
Mark, this is Priyanka here. We had a timeline and it was only open until then, the participation survey. Can we open that if people are interested? It's a question for all the co-chairs.
I think it could be useful.
So, yeah, I think as we're going to keep iterating over several weeks, it's probably good to keep things open, even if we sort of close data collection at certain points so that we can analyze data, we can keep things open so that more people can contribute. So yes, I think we'll try and do that.
Okay. Next question for social sciences, and Ingrid, I don't know, or Amy, or it's a longer question, so maybe let me give it a try here. So based on the draft documents produced by the social science subgroup, many themes such as ethical, legal, data sharing, data management do not seem to be unique to a subgroup but common across all sensitive data types. Are we doubling or quintupling our efforts? The more unique aspects for each subgroup would be the data type standards and resources. So question about cross-cutting elements.
Yeah, this is Ingrid. Well, maybe to clarify first, of course, the topics that were mentioned as the writing groups in the social sciences subgroup, of course, come from the structure of the recommendations document. Having said that, yes, they're all in that sense cross-cutting themes, but the idea, of course, is that within the different subgroups, the recommendations are geared towards that specific subdomain or type of data. But we have also already acknowledged that there are specific themes that are really very much cross-cutting, like the ethical, legal one that was already mentioned also in the presentation today, where we are thinking of bringing maybe people together from experts from the different subgroups to work together on those cross-cutting themes. And another very cross-cutting theme might be, and Michelle Barker pointed that out already in an email, is everything around software. So I think we also need to discuss in the group of co-chairs and moderators, whether that is another kind of cross-cutting theme. So it's kind of looking for the right balance between cross-cutting themes that we need to tackle through the subgroups and let's say more generic themes that we want to be geared towards the specific subdomains in the subgroups. And I don't know whether Amy or Irina want to elaborate further on that.
Right, thanks, Ingrid. I think
Amy
during the...
Could I just interrupt? Amy had her hand, wanted to speak, I think.
Okay.
I didn't raise my hand, but no, I think Ingrid said it well. We're certainly writing as much of the guidelines from our perspective as social scientists and trying to not sort of make generic offerings or recommendations that would be just iterating across all of the groups. So admittedly, we've started on the areas where that's easier to do, where when we're talking about the data types of the social sciences, for example, that it was not that hard to focus on our own domain. I think when we get to the other recommendation areas, we'll have to be more thoughtful about how to keep things separate, or perhaps there'll be some consolidation across the guidelines.
Okay, thank you. In the community participation section, there was a mention of a paper. Is that linked to in the slides, or could somebody add a link to the paper, maybe in the chat?
Yeah, I'll add it to the chat. So it was in the slides. I've put it in our question panel, but I'll paste that link in the chat as well.
Okay. And I also pasted a link in the chat regarding Open Air's initiative to curate resources. So that's there as well. Another one on the social science side, is it social sciences and humanities read history or just social sciences?
It's just social sciences.
And I would also highlight that the intent of the group is to have an initial output in the earlier timeline, and clearly the other efforts or other topics may well be brought up during these efforts and come on later in the timeline. Another question, where does imaging data fit into these working groups? For example, lung CT scans are becoming available and important in both acute and longer term care and treatments. So I don't know if that fits under the clinical group, or does anybody want to take that one on?
If one of the moderator can, because I have no firm answer on that. Anne speaking. Sergio?
Sergio may not have a...
Okay, so we will...
Sorry, I didn't get the question for our group.
Sorry, I'll just read it again. So the question is, where does imaging data fit into the working groups? And the example given is lung CT scans are becoming available and important in both acute and longer term care and treatments.
Okay. I think we have a telephone call with the chair and other moderators tomorrow, and we have to define what will be within the remit of our group and what not, because of course clinical aspects is a very wide area. So I think that I don't know whether we can face also the problem of clinical presentation, stratification of patients, the classification of COVID from a clinical point of view. Of course, there are many papers about radiological findings and how they can help to classify patients. I don't know whether we are going to cover this aspect, which is there are many aspects within the clinical area. So I think it's better that we agree within the group with moderator and chair, and also with the contribution of other members. So I cannot answer now whether we are also going to cover this aspect.
Thanks, Sergio. Another question, somebody has signed up for the omics group but hasn't received information about a Thursday meeting. Has that been sent out yet, Juan or Rob?
I don't think it has been sent out yet.
No, it's just listed on the wiki, and there is an event. I'm still struggling a little bit with the website. A message should go out as well. As we'll do that as soon as possible.
Okay, so we'll send a message out about that. I'm not exactly sure. I'll just mention this one and see if anybody wants to mention it, but somebody's asked about transcriptomics data. Does anybody on the omics want to consider that one, or?
Yes, of course. Transcriptomics is a part of the genomics, part of the omics. We would really like to hear about it. That definitely fits with our group.
Okay. And we have the open air one has been responded to. Next question is RT-PCR and serology data as well, apart from virus and host genomes. So maybe something getting at a serology. I'm not sure which group would be best to handle that one.
Anne speaking. In the clinical subgroups discussion so far among the moderators, the idea of biomarkers and that serology is getting into that have been discussed as being in the scope. And the tests as well. So I think this fits into that part of the group.
Okay. Thanks, Anne. So another question, somebody's joined two groups, social sciences and community. Discussion and level of detail is very rich, varies a lot. Is there a priority or low-hanging fruit given the deadlines? For example, policymakers or practitioners. So this is a remark. I don't know if anybody wanted to comment on it.
Yeah, so go ahead, Ingrid.
Sorry, Sarah. No, I just wanted to say there is a question formulated at the very end of this piece of text coming from Claudia, and it's not so much that we refer to the OECD as a way for us to leave the policy recommendations to OECD, as well as using OECD also as an organization through which we can disseminate on a high level any recommendations that come from our work towards the different ministries in the member states of OECD. So in that way, we can work together with the OECD organization. On the one hand, to make sure that we're not doubling work, but on the other hand, also very much as the organization that can disseminate the work that we do and the high-level recommendations that come out of that work. And I've seen that Carthy Smith is also on this call. I do not know whether he wants to add anything to that.
Could you repeat his name, Ingrid, so I can unmute him?
Carthage.
Carthage Smith.
Yeah, I've unmuted Carthage. Are you there?
Hi. Yeah, Carthage Smith from OECD. So it's exactly as Ingrid said. I think potentially OECD can provide, if you like, the policy audience for this work that you're doing. The way I would see that, so at the moment OECD makes general recommendations that, for example, data on COVID-19 should be interoperable across countries. I see the work that you're doing is actually how to make that actionable. And what potentially would be useful, I think, to join up the two is kind of the meta recommendations out of the work that you are doing that go further than just saying we need to make the data fair and interoperable, but don't go into all the detail of all the work that you're doing. So I would be looking at something like a 2 to 4 page sort of policy brief that we can give to people in ministries that says under each of these groups of data, these are, say, the 3 key things you should do, and provides the links to the other materials. That, of course, depends. OECD has its own internal quality control processes, et cetera, but I think we need to work together on what those meta recommendations would be. I would see it as it has to come out as an OECD policy brief, but RDA would be clearly acknowledged as the basically the expert input into this.
Thanks, Carthage. Now I have another question which may be seeking clarification on the cross-cutting, but maybe I'll just mention it more as a comment. Do we yet know options to contribute to cost-cutting tasks, or does that all initially start through the subgroup conversations? So I know that's been addressed. And did you want to say anything on the ethics legal discussion?
Yes, I think there are 2 main domains where we have this cross-cutting. One is more technical and one is ethical legal. What we are going to discuss in the conversation between the co-chairs and the moderators, this is one of the points. The moment when we start the recommendation, there should be a possibility, and I don't know yet the tool for that, at least an email, group email for people in the ethical and legal domain, and allow them to interact that all of the work that is being done by them in the subgroups can actually come together. And the idea was to have some general guideline introduction, or the general recommendation that are across subgroup first, and then keep in the subgroup the guidelines that are specific, really specific to omics or to AP or clinical, for example. So there would be two steps in that, the work in the subgroup and then work across the subgroup, but for specific specialties like ethical legal, for example. So this is not yet set in terms of tools, timing, but is one of the topics we are going to discuss with the moderators in the meeting that is just right after.
All right, thanks, Anne. Next question I have, is the omics group also looking to cover what are the susceptible variants for COVID-19?
Rob again. Are you there, Rob?
And while we're waiting for Rob to unmute, I know Priyanka this was part of the discussion with the co-chairs, I believe, as well as a cross-cutting between EPI and omics. Do you have audio, Rob?
I think I have audio, but I did miss the question.
The question was, is the omics group looking to cover which are the susceptible variants for COVID-19?
So I think so. I think that would fit perfectly. Yeah, let's discuss it in the group.
Anne, can I add something for that?
Sure.
I think that the susceptibility factors can be linked to specific clinical picture. So there should be some cross work between the omics, epi, and clinical for these susceptibility factors, or biomarkers, as I called them previously.
Okay.
Yeah, so they are genetic biomarkers, and definitely interoperability between the data and between the groups, therefore, is very important.
And I believe it was probably clarified that the EPI membership survey is not closed and there's no expiry date. So there is a link in the README file in the EPI Google Drive, and I've added the that information as well as the password into the chat. So if you do have any issues finding that document so you can get to the survey link, then you can reach out to one of the co-chairs, or sorry, one of the moderators. Then we had a clarification. Again, I think this will be in itself a theme, will be the cross-cutting nature of some of these things. So there was also the comment that things like medical imaging are important in clinical, but also epidemiology. So, and I think that is the goal of the post initial kind of outputs exercise, is to have we tend to refer to it as the editorial team that is looking at all of the 5 subgroup outputs and information from the holistic view, with the goal of kind of pulling together some of those cross-cutting themes if they're not immediately apparent in the discussion. So those cross-cutting themes are clearly not just in areas like ethical and legal, but also in some of the discrete medical and scientific aspects as well.
Anne, can I add something about that? There was in the EPI meeting also the mention that clinical trials often do not gather parameters that would be exploitable on the epidemiology side, and that clinical trials very often are concentrated on the clinical outputs, and a number of social characteristics of the patients, for example, are not gathered, and that would be tremendously important. And it's true that in the committees that look at the protocol for clinical trials, there is rarely epidemiology competence present, and so this is regularly forgotten. We might have a recommendation on that.
So I think we're done the questions. Juan, I don't know if you wanted to reiterate anything or.
No, are there any other questions? If not, thank you all for joining this webinar. I hope that you will participate in the subgroups vigorously, because that's where the majority of the work is going to be done. So we will have subgroup meetings during this week and another general catch-up in a webinar at the same time as this one next week. Anybody else want to make any further comments?
I would just make a general comment, Juan. I know I'm part of a not dissimilar effort in the Canadian context, and I know the work of RDA in trying to bring a set of lenses to focus the conversations, because it's such a, as we're seeing with the cross-cutting comments and others, that there's such a huge amount of information, and it's overwhelming in many conversations. So the group I'm on in the Canadian context has about 1,500 researchers in a Slack channel. And I know that the efforts of RDA are starting to be looked at as at least a way to have that initial conversation and bring some focus. And it is an effort that will extend beyond these initial outputs. So I just want to highlight that RDA's efforts, I think, are having value in other conversations as well.
Yeah, thank you, Mark. So as we said before, we will work as hard as we can to meet that first deadline or first timeline for our first output, and then iterate on that beyond there. In that case, if there's no further comments, thank you all very much for joining the meeting, and we will talk again in various fora during the week and then here again next week.
Thanks all.
Bye.
Thank you. Bye-bye.
Bye-bye.